people, you're welcome to another episode of Nursing with Abby. It's a beautiful day and we are so grateful for yet another day. Now today we are going to be talking about therapeutic communication and non-therapeutic communication among nurses to patients. Yes, you're wondering what's that? What can that be? Yes, we are going to really delve into it today. And it's a way of having our nurses get more knowledge as to how to take care of their patients, and if you know already, a refresher. Now, before I go into the topic for the day, I'd like to thank all of my subscribers for always communicating with me, always supporting this channel. I really do not take your support for granted. Thank you so very much. And if you're watching me for the first time, you're welcome. Now, on this episode of Nursing with Abby, I want to talk about therapeutic and non-therapeutic communication in nurses, but we talk about nursing lifestyle and everything in between. My name is Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. So we are going to be giving ourselves a little hint or information about how to therapeutically communicate with our patients and how not to communicate with our patients, which is the non-therapeutic method of communication. So if you get your pen and paper, because we're going to be doing a lot of write-ups, we're going to be noting a lot of points today. Now, we're going to start with therapeutic communication, and that is a method of communication which is best, effective, and efficient for dissemination of knowledge or information to your patient and giving adequate care to your patient. Now, it cuts across every sphere of nursing. It could be palliative, it could be preventive, it could be curative, it could be preventive measures, yes, safety measures, occupational health measures. So those are various ways, the various all through the various facets of nursing, you could use this method of therapeutic communication. So we're going to start with broad opening remarks. Now, broad opening remarks is just like the name says, broad opening remarks. It helps the nurse ask a question that would give the opportunity to the patient or the client to answer not in a specific sense. For example, if you say, what would you like to talk about today? It could be during a support group meeting or one-on-one physical therapy session where you just you want to just break the ice between yourself and the patient, and then you want to say, what would you like to talk about today? Yes, you could talk about your health, you could talk about what you ate this morning, you could talk about how you were able to administer your insulin appropriately for the past few days. So it's a broad opening remark, and it's very nice to open a line of communication between yourself and your clients. Now, another one is open-ended questions. Now, it's important that most of the questions that you ask your patient should be open-ended. Yes, because open-ended question gives room for more ideas, gives room for you to be able to decipher the thought or the minds of your clients, and then know how well you can best care for them. For example, you can say, tell me more about the voices you're hearing. For example, if you're talking about a patient who is complaining of auditory hallucination, which is the most common form of hallucination, so you could just open a line of communication. Tell me about the voices you're hearing. Now, that would give the client an opportunity to give you better information as to how the patient is feeling, which is the subjective data, and then you could communicate effectively to the appropriate quarters as to what you feel the patient has and how recommendations to help the patient be nursed to better health. Now, another one is sharing observation. It's just a way of making, you're not being judgmental. That's how I say this. You're not being judgmental. For example, saying that maybe you get into the client's room or space, and then you're trying to open a line of communication. You're seeing that the patient is quite depressed or downcast. You could ask a question saying that you seem sad to me today. May I ask the reason? Now, speaking it calmly and in reassuring tone, the patient will likely develop a sense of trust in you to give you a little information about why he or she is depressed. Okay, it could be something you know about, but you just want the patient to be able to vent or air his or her feelings, which could bring about therapeutic communication and therapeutic care. Now, another one is clarification and validation. Now, this is very important because we have a lot of information, because all these methods of therapeutic communication that I said earlier would give the patient an opportunity to vent out a whole lot of feelings. Okay, so as a nurse, it's important for you to be able to sift the wheat from the chaff, from the various information given by the client. So this method of like clarification and verification is like validation, is like seeking understanding to a vague or confusing issue. For example, after the client has given you information as to the voices he's hearing, you could, or information about what do you like to talk about today. So after pouring out such information, you could just ask nicely, are you trying to say that anxiety is the main cause of your insomnia? So in one sentence, you've been able to encapsulate the various information given, and then you can probably use that as a form of validation to know if you're actually on the same page with the client or the guest. Another one is reflection. Now, this reflection is also very important, especially when you're trying to achieve behavioral change. Now, the client can ask you a question after I develop a trust or rapport with you, and ask, do you think that I should commence the new medication, considering the side effects? Okay, now she's not expecting you to say yes or no, because the choice completely belongs to her. And as a nurse, you should not advise. You should just give informed consent as to maybe treatment options and alternatives, benefits and risk. So with the method of reflection can just give you the opportunity to say, what are your thoughts on this new medication? So you're helping the patient to reflect on the question he asked you, and then try to get an information or an answer from the informed decision. So you don't force a patient to take medications, you don't force a patient to take any drug, you don't force a patient to take any therapy or treatment, even if the therapy or treatment could be life-saving. So the patient has the final say as to accepting or refusing any form of treatment. Another one is offering self. Now, this is a beautiful method. It could be even for children. You could also use it for children. You could use it for adults, where maybe a form of painful procedure is going to be carried out that might be a bit discomforting to the guest or the client. Now, you could offer to be like, okay, I'm just supposed to give you an information about this procedure, but during the procedure, I'll be right here with you. I'll stay with you while the procedure is going on and walk you through all the way. Now, that is the method of, a therapeutic communication, just knowing that there's somebody there who has offered himself to just be there during the painful procedure will give a whole lot of comfort to the guest or to the client, and will be able to help the client navigate through the painful procedure better. Another one is presenting reality. Now, this presentation of reality is very important for guests or patients or clients who has lost touch with reality concerning or considering their medical condition. For example, those with organic heart and brain disease, those with dementia, you need to present reality to them. Now, they can tell you, I'm hearing voices. Now, you don't snap at them and tell them you are going nuts or something. No. As a nurse, you can't tell them that I understand that you are hearing voices, but I do not hear any voice. And that's the reality. You cannot force your own how do I put it now, demands or your own intuition on your guests or your clients. So you understand that, okay, you respect the fact that they say they're hearing voices, but you're also in the room with them and you cannot hear any voice. Okay, and that's a direct presenting reality. Okay, yes, that's a way of presenting reality. It's not a way of shying away from it, but presenting reality to the guest. Also, we can have silence. Silence is a method of therapeutic communication if you can do it well. Okay, for example, if you want to allow a guest to make a decision after making all the informed consent, and then the guest looks at you eye to eye and asks, do you think I should pick A or B? And then you are like, it's your choice. So that's the method of silence. You're not forcing, you're not enforcing, you're not lauding your own opinion or your own opinion to the guest, but you're giving the patient the opinion to choose through your silence. Okay, another one is eye contact. Now, this is very important because there are some particular cultural sentiments or cultural beliefs that eye contact is a way of insult. Okay, so you really have to know who you are dealing with. For example, in the advanced countries of the developed world, they expect that confidence reveals your ability to maintain eye contact with whoever you're talking with. For example, I'm maintaining eye contact with this camera to ensure that I'm able to communicate effectively to whoever is listening to me. Now, some cultures and tradition believe that if you're talking with maybe an elderly person, you tilt your head down looking at the floor while you talk. Some Chinese, yes, even some parts of Africa, it shows the sign of respect when you bow your head to speak with an elderly person. So you really need to know the cultural inclination of your guest or client so that you can effectively manage or take care of such a patient when it comes to eye contact. Also, therapeutic touch. Now, this is also a bit connected to eye contact, because therapeutic touch is how do I put it now? It's just a way of trying to show empathy, but maybe misunderstood in some quarters, especially when it comes to opposite sex. Okay, so if a male doctor is trying to console a female client, you cannot just expect therapeutic touch like that. It could be misquoted or misunderstood. But if such a guest requests that, please could you just hold my hand while I go through this, so like as I was saying, therapeutic touch is very important for you to be able to administer care, but you need to know who exactly you're administering the therapeutic touch to, because there are some who may misinterpret or misquote the reason or the essence of the touch. So you also need to be observant and be very sensitive when it comes to therapeutic method of communication. Now, I'm gonna have to break this video into two. We talked about therapeutic communication today. That I said broad opening remarks, open-ended questions, sharing observation, clarification and validation, reflection, offering self, presenting reality, silence, eye contact, and therapeutic touch. Now I'm going to add one more, which is reinstating. Okay, reinstating is just like reflection, but in reinstating is just trying to give a concise how do I put it now, a concise summary of what your patient has told you. Reinstating could be, okay, I'm so anxious that I can't sleep. Now the nurse can try to reinstate that particular statement, saying that, is your anxiety what is keeping you up at night? So if the patient can now admit to that, then that's a way of really validating what the patient is actually saying. So I'm going to continue with non-therapeutic communication in the next episode of Nursing with Abby. So make sure you stay tuned and make sure that you, in whatever nursing care that you're giving to your client or guest or your support person or whoever you're attending to as your client today, make sure that you make use of this therapeutic method of communication, because they would help you to be able to understand your clients better. They will help you to be able to administer effective care, and they will help you to ensure that adequate nursing practice is installed. Thank you so much for another episode of Nursing with Abby. Please ensure that you like, share, and subscribe so we can grow this community together. This community is growing really fast and wide, and we are being noticed around the world. So thank you so much. I'm open to collaborations, inquiries, advert placement, and sponsorship. So you can reach me on my email address scrolling on the screen. Until I see you in my next episode of Nursing with Abby, it's bye for now.